Hey, what's up, guys? It's Dr. D. Just want to talk to you about laser surgery and options and what the process is and what the protocol is and, cost-wise and what the experience should be. And bottom line is that laser surgery, gosh, we've been, helping patients with laser surgery options for the past 15 years, and it's been a great option for correction. And so typically we actually operate on patients who are nearsighted, and it ranges anywhere from 22 years old all the way up to mid 60s, 62, 65, around there too, and everything in between. So laser surgery is great. So I've been getting a lot of requests and a lot of referrals. So first off, I want to say thank you so much for everybody for referring their friends and family to us in regard to laser surgery, because it is life changing too, right? Hey, what's up, Hiroshi? How you doing? And so laser surgery, we do first off, you'll need to have your prescription to be stable for at least a year. Okay, and if you wear contact lenses, you have to be out of your contact lenses for at least 3 weeks, 3 weeks or so. Okay, out of contact lenses, so wearing your glasses, and effectively what that does is, so this is your eye, an eye model, and the part of the eye that we operate on is called the cornea, which is this part right here. Okay, so the cornea is actually only so thick, right? And so, but in any event, we want to make sure that the cornea is healthy. We want to make sure there's stable prescription. We want to make sure that there's no, dry eye problems or anything like that too, because patients with dry eye issues, typically, we don't do the surgery on, because laser surgery results won't be as good if the eyes have a dry eye, long-term problem. But in any event, first of all, baseline comprehensive eye exam for patients. Hey, Monica, hello. And so we go ahead and make sure that we get the prescription. Use a slit lamp microscope back here to go ahead and make sure and check the external and also internal parts of the eye to make sure there are no diseases, no health issues in regard to the eye, and make sure that the eye is A-OK and perfect. Environment perfect situation for laser surgery. Okay, so that's said and done. So you need to have a comprehensive eye exam. Second, what we do is that we, send you over to the laser center, and our laser center technicians and coordinators, Jan, will go ahead and schedule a pre-op consultation, a free consultation for you. And you would go over to the laser center and get some preliminary diagnostic testing done at the laser center to basically get some diagnostic tests. So here's some of matter of fact, we have some of our patients. This is actually the Pentacam, some printouts that we have going on here. Okay, and it gives more information about the eye, that we would go ahead, myself along with our laser surgeon specialist, they'll go through all these all these diagrams and reports and everything too. And if everything looks good, looks good, then we go ahead and schedule a surgery date, and we do the surgeries on the last Fridays of every month. Okay, and so the laser surgery procedure, it's pretty cool too. So the laser that we use is called the I-LASIK procedure, and what's really great about it is that there's so many different varieties of laser surgeries available nowadays. Hey Shafali, hey Sergio, hello, hey, what's up Kevin, how you doing? And so, what we don't do is that we don't do the first generation laser surgeries called RK. And that's called archaic in our industry. We don't do RK. We don't do some cases we do PRK as well. There's the microkeratome flap laser surgery, but what we do is called I-LASIK, and there's absolutely no blade at all, which is really cool too. So it basically makes a lot easier for the patients, a lot more comfortable. The results are actually more stable, and the recovery time is actually minimized to the bare minimum. So everything looks good, right? Friday comes along. What we would do is actually give you some relaxing, Valium to chill you out a little bit. If you're a little bit nervous, make you feel real comfortable as well. And then we'll go ahead and do the surgery and have you get the laser surgery done. So let me go and flip the camera around really quick. And what we have here is an example of LASIK. And so here we have the eye. It's perfectly numb, by the way. The eye is completely numb, and so you don't feel anything. But basically what it is that we use a laser to go ahead and apply on the top superficial layer of the cornea. And if you look on a microscopic level, what the laser will do is just come right through here. And what it does, it causes the molecular bonds to separate, and creating the separation there, and allowing us to move the superficial layer of the eye out of the way. So you see this flap right here is really super thin. And what's really great about the I-LASIK procedure is that we can dictate how thick that flap is, versus using a microkeratome blade. So you have these underlying corneal tissue exposed, right? And what we do is that from the mapping that we have here, we got this map here, right? Okay, and so you can see here that you do have the map. And so the goal is to have the map to be all green, right? You have blue, green, yellow, and in a perfect world, you want to go ahead and have the laser correct all of that. Okay, so we take the laser, it's all computerized, by the way, all calculated. And so we use the laser, and you can see as the layers are being applied, you can see that the map is actually getting more green, right? Let me back up a bit. Let me go back. See that? So here's the initial map, and then we have the laser being applied. And just pay attention to the laser here and what's happened to this map right here. It'll go ahead and clean it up. See? To where in an awesome world, you want the map to be completely green like so. And that means it corrects all the prescription and all the funky distortions and everything like that too. And that takes about a minute and a half each eye. Okay? And so once that is all said and done, then we go ahead and move the flap back in place, and we have a little tiny sponge, a lubricated sponge, and we go ahead and flatten up the cornea, and voila, you have a laser surgery. Here's it all. The other eye, we lift up the flap. What's up, Scott? How you doing, bud? We go ahead and move the flap out of the way, expose the underlying layer, and then we go ahead and do the laser. Okay. There we go. Exposing the underlying layer there, taking the laser, correcting that prescription, making that map all green, right? So, Jeff. And then we go ahead and scoot the flap back on, and then da-da, done. And that's it. So, the follow-up procedure, by the way, as well. So again, we're doing the laser surgery on Friday. We do a post-op appointment with the patient, 1 day, 1 week, 1 week, 3 weeks, 3 months, and 6 months after laser surgery. And then we go ahead and see the patients 1 year on their anniversary date for their comprehensive eye health exam, right? So even though you get laser surgery, it doesn't mean that, you say, oh gosh, I don't have to go get my eye exam anymore. Not the case, okay? Because even though you got laser surgery done, you just still have to make sure that we do an eye health exam to make sure that the cornea is still awesome, still intact, and still, cool. But also, too, you got to make sure that everything internally is healthy too, because as you get older, right, you have a health condition, you have diabetes, you have blood pressure issues, cholesterol issues, systemic issues and everything too, and it can then manifest inside the eye too. So those of you that probably had laser surgery done, don't think you have to get, you're scot-free from eye exams, okay? You have to get the eye exam once a year to make sure everything's good. Hey, Chelsea, hello. So that's basically what we would do. The post-op. So post-operatively, again, we see the patients Saturday morning, and we just go ahead and put the eye chart up on the wall and see how they're doing, and then also to take a really baseline eye health evaluation with the slit lamp behind me. and we go ahead and make sure that it's healing appropriately too. So what's great about the cornea on the front part of the eye, it heals itself usually within 24 to 48 hours, and there's of course there's inflammation and everything too, right? So there's antibiotic eye drops given to you. There's anti-inflammatory eye drops as well, that's given to you as well. You take them 1 drop in each eye 4 times a day for the first week or so, and that's why we see you 1 week after the laser surgery, so we can actually make sure it's healing right, make sure the inflammation is toning down, and usually about the hey Daryl, hello sir. Usually about the 1 month, 1 month, 2 month period. If there is any residual prescription after everything's all said and done, we can actually go back in and relift the flap and correct the prescription if we need to fine tune it. But in 15 years of doing this, I've never had to send anybody back for a touch-up or an enhancement. Hey Steve, how you doing, sir? So that's what's really cool about it too. So again, the laser surgery procedure that we do and co-manage with is called I-LASIK, which is no blade. It's a 100% laser, and there's no microkeratome blade at all. And so, in regards to the laser surgery, the fee for that, it's total for everything, by the way. Just to let you guys know, it's equivalent to getting braces done. Okay, so you're looking about $2,500, for each eye, right? You're looking at about $5,000, total, and that's including everything. That's including the pre-op care, that's including the surgery, that's including the post-operative care. That's including everything. So there's no surprises or anything like that, right? And so some of our patients, they take care of it, with their flexible spending accounts, their FSA or HSA. Insurances do not cover it. It's an elective surgery, so it's a cosmetic surgery, so there's no insurances that cover it. But there are interest-free or really great payment plans available, and we partnered up with if you go to carecredit.com, they give you a breakdown of laser surgery financing options for you. So whatever fits your budget, you basically would go onto the carecredit.com website, put in the dollar amount that you want to go ahead and finance, and they'll break it down for you and give you options that you can choose. And that's basically what's really cool about it. Hey Patricia, hello. Hey Twee. And that's basically it. It's pretty routine. Try to minimize the any complications as much as we can. We are very, very conservative in terms of for the laser surgery patients. And gosh, we've been, my whole entire family's gotten it done. My high school friends, my college friends from us. My aunties, all my aunties got laser surgery done through us as well too, and everyone's seen like a ninja. So, but again, everybody's different though, right? And so, but if you are interested in laser surgery, but please give our office a call. You can go to midtownoptometry.com and you can request for a comprehensive eye exam because you need a baseline comprehensive eye exam first. And then we have that discussion and get the ball rolling and set you up with a free consultation at the laser center and see if you're a great candidate. Not everyone's a great candidate, by the way, too. Okay, so typically the prescriptions that we take care of the most are people who are nearsighted, people who have a astigmatism, patients over 40. However, okay, just to let you guys know, people over 40. Who are nearsighted, if we did laser surgery on you, there may be a necessity for computer glasses after the fact. Okay, so it basically would reverse the situation. So you don't need any glasses for far away, but because you're over 40, the focusing muscle that's inside the eye right here is not working as good anymore. So you'll need to wear glasses when you're on the computer, when you're on a tablet, when you're looking at a menu or something like that too. So a lot of our patients want to make sure that we discuss that with them too, because a lot of people have a misconception that once you get laser surgery, you don't need glasses. That's a yes and a no answer to it. Okay, it really depends what your prescription is. So to really find out what's the best option for you, go ahead and make an appointment with me. Okay, go to midtownoptometry.com. Okay, request an appointment online, or if you want, go ahead and jump on the phone and give us a call. at 209-957-8000, and one of my front desk team members would be more than happy to get you all scheduled and stuff like that, and we have a conversation. Okay, so hopefully this helped, because I've been getting more and more patients asking me about laser surgery and what my opinion was and what my thoughts were, and so I really appreciate everyone for thinking about referring their friends and family to us for their eye care, and I appreciate it. Thank you so much. So if you know somebody that wants to consider laser surgery, please share this video, and if you shared it in the comment section, please put in #shared. And so I give you a shout out and for sharing this Facebook Live video. And if you're not watching this live, but actually watching this on a replay in the comment section as well, please go ahead and type in #replay, so I can give you a shout out as well too. So I appreciate you guys taking a little bit of time to watching this Facebook Live, and I'm not just randomly talking to myself. In any event, if you know anybody needs my help, you know where to find me. Dr. D, Midtown Optometry, and I'm out. I'll see you guys later.